what we are going to do is we can, I just want to make sure.
Yes.
Okay, I have one caller. Is there anybody else on the line? Okay, I'm only seeing one. So I'm going to put you in a mute function, and hopefully you are still hearing me. Okay?
Okay.
Muted.
Everybody is muted. Okay. Is it fair to say we have 2 callers, or am I one of them? Yeah.
You should be the main number there.
Okay. Yeah. This is me, and that's our caller. Okay. Wonderful. Okay. No, that's.
Okay. Welcome, Auburn. Tonight is Friday, March 20th, 2020. It is now 4:55, and I'd like to open the meeting. Excuse me, we have Steve here, and we're having an emergency meeting to discuss tonight the COVID-19 Emergency Action Plan.
Thank you, Caroline. So we, okay, we just had the, you get Mike. So thank you very much. We have requested for the board to meet for an emergency action response. As you may know, we have an evolving situation that has that's changing daily over the past weeks, and wanted to bring you together for the emergency just to just kind of keep you updated on what's happening at the town level. So we have, as of the beginning of this week, the assistant town manager met with all the department heads and for an emergency meeting. It was discussed, the current situation and what's happening with the fast track of the coronavirus. As part of the discussions, there are several towns that have taken some action to try to mitigate the virus spreading in municipalities. As part of that discussion, we have had to look at what the workforce is and to try to make sure that we can keep as many people working as possible. And as part of our everyday duties, we interact with the public. That's obviously what our purpose is. But to try to look at what we can do to try to minimize the contact of people coming in contact with one another, similar to kind of the way we're situated here, trying to keep a 6-foot distance between us. So working with the town manager, they decided to close all town buildings to the public. Now, closing the town buildings to the public does not mean that we're closed. We can still interact with the public through phone or email. However, the evolving situation, things have changed kind of on a daily basis with either something from the federal government or from the state government. So in closing the town buildings, we have had obviously less physical contact with the public, but obviously still handling in-office operations. The governor has had numerous press conferences along with the president, and there have been a lot of different actions that have come down that include the boards of health. One of them earlier this week was the restaurants and bars being able to just offer takeout only. So that is that's something that went into place on Tuesday. I can tell you that we have been in contact with all of our permitted establishments, and the sent out the order and guidance on making sure that people are adhering to that. We have had some complaints on that. As you can imagine, it's not a popular order, but it's one that we have the authority to enforce, and the governor expects the boards of health to do that. So we have already dealt with at least one of those complaints, and we've had numerous calls to our department about various questions. A lot of them not questions that are in any clear, decisive manner. So we've had a number of calls to the state, and the state has had they're pushing out a lot of information. They're trying to keep the mass.gov website updated as things change every day. So we have been in contact with the state at some point, almost daily, with either questions or something that we're asking, or conference calls. So that has been very helpful. I think the state is trying to get as much information to us as possible in order to help us be able to handle the actions that are coming into our department. And on a town-wide level, so we are handling those type of things with businesses, and Eileen and our staff have been in contact with high-risk facilities, the long-term care facilities. Eileen's been in contact with somebody from those facilities almost daily, sometimes several times a day, to be able to try to mitigate any concerns there as well. So we have been extremely busy the past several days. The town has a local emergency planning management committee that meets on a regular basis, and members from that committee have also met this week to try to talk about how to maintain staffing levels, because if somebody does happen to come down with symptoms or is exposed to somebody that has the virus, how that is handled, especially like if it affects the workforce here, and trying to maintain as many people who are feeling well to keep it in that venue. So we're looking at staffing in different different ways as well, in different timeframes. Yesterday, the assistant town manager was in contact with the Board of Selectmen and the town manager, and they declared a state of emergency at the town level. And this is consistent with many other towns that are doing this. This is being done in other towns in conjunction with the Board of Health. The Board of Health can take their own consideration to do this, and I actually have, in your packet what the exact wording is. It lays out basically the timeline of events that have occurred in the recent weeks with COVID-19, obviously, globally being a pandemic, the governor declaring a state of emergency, the World Health Organization declaring a pandemic emergency, the President of the United States declaring a national emergency, and then all of the emergency actions that the governor has put into place. I think I mentioned the restaurants, gatherings of 25 people or more, prohibiting that, the schools closing for a period of time as well. So those are all things that have already occurred, and we are looking to obviously build upon that. We are already taking emergency action, so I can tell you we've already been doing that work, but what this declaration would allow the town, the Board of Health, is possibly some resources that may come as a result of the declarations that have already been made. So this is something that we're not the first in the state to do it. There are other towns that are taking this action, and I do know that. This declaration is allowed in accordance with Mass General Law, Chapter 44, Section 31, called Liabilities in Excess of Appropriations Forbidden Exceptions. So again, it helps us receive funds if there are funds to come down from the government. So in that same frame, we do have also this week, you may have recalled at one of the press conferences for the governor announced that there would be, I believe it's $5 million that he was earmarking for boards of health to be able to use that money to help in the actions that we're already taking. So that was announced earlier in the week, maybe Tuesday, somewhere in the range, Monday or Tuesday. There was a request that was sent out to every Board of Health in the Commonwealth, and we had to respond in a 24-hour period of just a request for money of what we think we might need. We know we don't we don't really know exactly what we need, but we know we're going to need help, and that help may look like more nursing services, because as you know, we do have a public health nurse, but as you can imagine, with this type of scope for the number of people that may be affected by this, we're going to need help in that venue. So we did put in a request to the state, and again, it was like real general, but for services, nursing and staffing services, supplies, one of the biggest needs, as I'm sure you've heard, is personal protective equipment. That is obviously a very hot topic and very scarce. So that was also put in as a request, and we're looking to have estimate what we are going to need in the coming weeks. I think that there's a number of different There's a number of different timelines that I've heard that they expect this crisis to go. So we don't know what we're going to need as we move forward, but we know that we'll need some staffing help. So that request did go to the state, and the state is reviewing that as fast as they can. And I think when they're able to take a look at that, it's my understanding that they are going to be sending back to the boards of health money to be spent. So the declaration that I provided to you, I think that just helps in that venue. This declaration does not have to be authorized in order for us to get money from the state, but this may help if there's other pots of money from the government. All right. So that's a general overview. I can tell you we've both been handling calls, but I know Eileen is dealing with a lot of the businesses in town directly. I mean, we're happy to answer any questions for you. I did provide just today, I printed up the case report. So as you may know, every day the Mass Department of Public Health will update their website. I think it goes on between 4 and 5, somewhere at the end of the day. And they will identify how many cases they have in each county. I think unfortunately, I do think that there was a death announced today. That is, I believe, the first death in Massachusetts. Obviously, around the country there's been numerous deaths, but I think Massachusetts announced their first death today. It's a serious situation. We are already inundated with calls surrounding it. So we want to just put out as much information as we can, and honestly, we need everybody to help try to mitigate the spread.
Do you know, is there any kind of coordinated effort or communication with the senior center, or?
Yep. So the Assistant Senior Center Director has been at several of the meetings. I think we've had at least 2-3 meetings this week, and meetings, even pre-planning meetings in the past several weeks. So we have stayed in contact with her, and they do have a nutrition program. So as part of the town buildings closed to the public, there were some exceptions. The nutrition program for the seniors is one of the exceptions, because obviously we wanted to make sure that seniors are still getting their meals. So that program is still running. I think they have about 70 or so meals going out each day. So that is continuing. And we stay in contact with her. She reaches out, and we're in contact with her. If it goes both ways. She's been wonderful. Yeah. So I'd like to just, if you can consider, looking at this, and if obviously, if you're comfortable, I would recommend, approving this declaration.
I could certainly present the motion, but I was hoping our chairman would be here. So, but we can, if it's all right, just wait. I don't know if anyone's heard from Eric yet or not.
Sure, I can, if you don't mind, I'll just see if I'll step out for just a moment. Okay. Just see if he's on his way.
Would that seem reasonable to you, Carolyn, if Eric's on his way, to give him the opportunity to review and...
Oh, absolutely. Sure. Mm-hmm. Absolutely. It's windy.
Typically like that?
Nothing has been difficult this week, so I'm going to go with it. Yeah. I do think we were expecting some rain. I think that I did hear that
Is it
we're
moving out? Yeah.
some rain this
I'm
afternoon.
going back to work tomorrow, so it's going to get really nice again. I had the last 2 days off, if you couldn't tell.
You couldn't do much, could you?
No.
Well, you're well rested, and I'm sure they need you.
Yeah.
I don't know if,
I think one of the really important things, which I've seen on the town website, is bang right up on the front page. You know, the Board of Health, the COVID-19, the links to the Massachusetts DPH, the CDC, and even the WHO, the World Health, because people want information. Let's get the correct information.
Absolutely.
Even from the background, the broadcast.gov every day, the conferences that we're having, they're telling us, they're putting it up there. It's there. That is the most current. If you go on today, the sheet that Darlene printed with the cases is, it's from March 19th, because at 4 o'clock they'll do it, but March 20th updates from all of the other things that came down from Governor Baker are there. It's
And that's a
current.
very, very important thing in any crisis like this, is to get accurate information.
And that's what we do.
And it's great that it's right bang on top of I was just saying, when I went onto the town website, auburnguide.com, the COVID-19 information, I believe, was right there on the front page. So, you know, folks that need to get information, the links to the DPH, Massachusetts DPH, the CDC, and of course, World Health Organization, you know, bang, you want to get local information, you know, the Board of Health, the state information, DPH, the nation, we're talking CDC, because you can't go on hearsay information. We need to look at the specific organizations, the state and government organizations that are, you know, have the intelligence, have the people that are frontline directing, guiding, and investigating this.
And I think I'm glad that you actually saw that. We spent a lot of time with our IT department to try to get it so that you can see it as soon as you get on that website. That's not always, it's not always easy to get things where they don't drop off, or, you know, as the date goes, and something else gets posted, but we spent a lot of time working with them to be able to keep it there. So things are changing quickly. We have more to post on it, but as the press releases come from the state and as they send them out, we try to get them up on there. There's been a lot that's happened this week, so.
Appreciate, you know, having that accurate information available to people, because speculation and guessing and, well, my mother's cousin's uncle brother said, you know, is not accurate. What we need is direct communication from the authorities.
And one of the things that is worthy to note is that some of that guidance, actually a lot of the guidance, has changed. Like, so even when you go to those websites, something that was there even like last week is completely different now. So it is changing as the situation is kind of moving forward.
Well, as the political and social situation changed, but as well the medical, you know, the research that is being done, the investigations that's being done, and things like that, very dynamic.
Right.
So it's important to look at the current stuff, and it's great, again, that those links are right there. I appreciate that. And kudos to our IT department for getting it right up there on the front page.
Absolutely.
Yeah, and especially if you need it in a different language, too. I mean,
Yes.
it's probably not such a big deal, but, you know, it's helpful.
Yeah, they do have that, I think, on both sites.
Yes, they do.
Yeah.
Yeah.
So just an update, the chair is on his way, but he's not sure with the traffic.
Okay.
You know, your option, he's obviously supportive of the board if you want to
Okay.
move forward, or if your option would be to do a recess wait for him to get here, but he's completely supportive of your action.
Couple of questions I had on some of the things were actually something that maybe you didn't address, but our dispensary site trailer that is currently up to date and stocked up par and everything.
So our trailer, as you may know, is stationed here. And the trailer actually went through some repairs this past fall. So we were fortunate to be able to have the trailer's a bit old now. I want to say, so it's 10 plus years.
Yep.
So we did have a little bit of problem with some of the seals on it. We were able to get that fixed. And so literally, in order to get it fixed, we had to take everything out and then put everything back in. So everything's organized in it. And when you say stocked,
Inventory is.
yeah, I mean, we have all the equipment, the regular preparedness equipment in there, but as far as any PPE, any personal protective equipment, pretty much all of our PPE that we have had, we have obviously shared with the first responders, fire and EMS, because they're the ones actually going and responding to calls.
That sort of brings right into my second question.
Okay.
When you were talking about emergency funding to improve our stock of PPE, is that something we're able to share with our public safety officials, or do they have their own separate avenue that they're pursuing as well?
It's a great question. I can tell you we work collectively.
Yes.
So we have been working very closely with Chief Coleman and Assistant Chief Johnson to be able to get those requests for what they need right up to the state. So we've been, actually, I think as of last week, we were working on that. And in several of the meetings that we've had, the planning meetings this week, we've stayed in contact. Any of the funding that comes down, I don't know if they have their separate funding.
Right.
I'm not sure of that, but obviously we would, it's not, your department or my department, or it's everybody
town.
working collectively.
Right. And it certainly.
Try to get, the goal is to keep first responders and everybody that is trying to stay well and move people to a better place during this health crisis. I can tell you, I feel 110% comfortable working with all the departments to be able to, we have, I think, great communication, so.
Because we certainly want to protect our first responders, and I don't think anyone would disagree with that. But we'd also want to try to look for the hopeful future where immunization may be an option. And to open a dispensary site, we certainly want to be sure that the supplies necessary for that are up to par.
And I think that's part of why the state is asking what you think you might need. We know we would need a lot of things. But like over the years, we've had things like signage and cones and, like hard equipment that we would use to set up a actual site. We've used those. We actually exercise and use them.
Yeah, we did it not that long ago.
Excellent.
Yeah, I was just
So you
gonna
do
say,
remember that?
I remember we
Yeah.
did it, yeah.
So we've got easels, we've got things like that to help when people come into, a town clinic of some sort. We actually use most of the stuff for our flu clinics, and we use them every year. And honestly, it's really nice equipment. We've gotten it through grant money, and I want to use it. The more you use it, the more you feel comfortable with it. It's not foreign when we actually,
And it's good, too, because we get to cycle through those disposables that will
Yeah.
expire, so, and restock them as necessary.
I mean, we do have some administrative stuff that, we've got all like the clipboards and pens and even pens, they dry up, but, I mean, we've got like staplers, we've got all that kind of stuff, we've got a copier, actually, the copier I think we've got to check out, but, yeah, we do have that equipment. So that, I'm again, comfortable with the trailer being able to use it. We did use it for the last flu clinic, and again, the fire department, they are wonderful. All I have to do is make a phone call, and it shows up to wherever we need it. So that's wonderful.
Plus, if, when we set up the vaccination site at the high school, what we did too is we also used some of the high school cones and some of their equipment that we have access to as well.
Yep. Everybody, I mean, I can tell you, if somebody has equipment, they're sharing it. That's not a problem here.
I wasn't worried about that.
Okay.
That would be the case, but
Yeah.
I'm more curious as if, with the funding that we would be eligible to receive, would we be able to share that as well? So,
I don't know that specific answer, but I would imagine if they sent us, if they sent us down funding, they would identify, what you're able to use it for. So hopefully that helps. You're welcome. Do you want to,
Carolyn, any
I'm
other
comfortable.
questions,
except
comments?
No, I feel pretty comfortable with moving forward.
All right, well then I shall lay a motion in regards to the declaration of emergency for COVID-19 dated March 20, 2020, that we approve and accept as presented. Thank you.
Accept the motion. All in favor?
Aye.
second?
I second the motion. All in favor?
Aye.
Aye.
Paula, you have that? Thank you very much. We will continue, actually, you know what? While we're here, this is a clean copy. I'm going to have, do you mind signing
No,
this copy?
that's fine.
Carolyn? And that way we'll have an official copy that everybody signs. Today's the 20th, 3/20/2020. A lot of 20s. Thank you. Yes, out of 20s. Okay. All right, thank you very much. Do you have any questions for us regarding anything? I mean, obviously, things are going to change as we move forward. We will be in touch with you as to when we, would meet again, and we're obviously trying to figure out the remote access. So, going forward, we can hopefully use the technology to be able to, interact that way to keep it as safe for everybody as possible. So that is definitely an option. I can tell you, just since we've been dealing with this emergency, the regular routine required items that you normally hear have been put on hold temporarily. My goal is to be able to move those forward. So if it's something that the board needs to meet on, I don't know if you want to identify any leniency for allowing approvals to happen for any of the plans. We normally have a meeting if there's any local upgrade approvals or any waivers like that. Those are consistent with usually like Title V items. So that would be something. I know there's things that are being looked at, and some of the laws are being relaxed in that venue for normal, like open meeting laws. There's different things that they're taking a different approach on, at least for a certain amount of time during the emergency.
In regards to your day-to-day operations, I would have no problem giving that flexibility to your department in regards to LUAs for, within obvious state guidelines. Anything that kind of creates angst in you to go ahead with, certainly bring it to the board. That would be my personal, and I would leave my...
I think that's a good call, Steve, yes.
We still need to try to keep business moving
Sure. Yep.
ahead, and with everything else to, again, just as temporary during the emergency
Yeah.
periods.
Okay. Thank you.
Leave it to your discretion and judgment.
Thank you.
If it's a reasonable, we've done it in the past type of practice, then I have no problem just, trusting your judgment.
Okay. Sounds great.
You can run that by Mr. Otterson as well.
Oh, okay.
Speaking of whom?
What's that? Oh, yeah. Perfect.
How are you?
All right, sorry I'm late, guys.
I was just talking about day-to-day operations and some of the simple things, Title V, LUA kind of things, that would generally come to the board in light of the current emergency situation. I was expressing my willingness to allow the department to move ahead with those variance requests, as long as obviously they meet state guidelines. We can never go below what the state would require. And
Absolutely.
things that we would typically approve, in their due judgment, I would have no problem letting them move ahead with that decision. Of course, any kind of decision that they would have a concern with, certainly I know they would bring it to the board.
Yes.
Absolutely.
That's great. Thank you. And that is, they just took a vote for the declaration.
Okay.
I obviously expressed your support.
Yep.
And can officially have the document. And the Board of Selectmen, I think I may have told you, the Board of Selectmen were aware that the town manager also took a vote to declare the town emergency.
Right.
Yep.
Yeah, town emergency, right. Perfect. Okay. Great. Well, thank you both for doing this. Sure. So this is the original copy?
Thank you very much.
Okay.
So I don't have anything more unless you have questions for me, and obviously, if you have something for us.
Nope. I don't have anything on the town, the Board of Health side of things. I think you guys are doing a phenomenal job. I'm in these meetings with department heads through emergency management as well, so I kind of wear both hats with doing this, and just for the public out there and for the fellow board members as well. I cannot speak more highly on the Board of Health staff here and what they're doing day in and day out, lack of sleep, getting caught up on these regulations. These regulations change sometimes by the hour. Darlene has kept me in the loop as much as she can, and I'm certainly appreciative of that. I try to filter as much stuff as I can to you guys, but I'm so tied up with emergency medicine, and I still have to work in the emergency room as well. But and I think it's important to know that anyone who's watching this knows that you have class acts up here, consummate professionals, and in the day-to-day operations of the town of Orange Board of Health. very happy that they're there, happy that they are doing everything they can, and it doesn't go unnoticed by me, and I want to convey that to the general public as well. I know the fellow board members know that as well, so.
That's nice.
I certainly wanted to say that as well. I know it's scary, but everybody will get through this and just kind of follow their lead, and, you know, everybody will get through it, so, okay? All right. Thank you guys, and seriously, I cannot say enough, but, all right, so you ready to adjourn?
Do we have any calls in the queue with any comments from
Not on
the?
that, it got knocked off when they
Yeah, we, unfortunately, we were,
okay.
we were on, and then it got knocked off, so we will attempt to,
From the technology problem, we were unable to take comments or from the public, but
we will, as part of this meeting, obviously, we'll prepare the minutes, and those will be put on the website as soon as possible. We can put the minutes, I think, on draft form, but they'll be in draft form until your next meeting, when you approve them, and then as soon as they're approved, they'll go on the website. It's uncertain. We're trying to get everything to work, and we're doing our best to set the remote participation up.
Yeah, certainly uncharted, never tried before, but certainly a work in progress, so excellent. Okay, but I mean, people can, obviously it's going to be rebroadcast as well.
It will be, yes.
And it's live now, I take it, right? So, yeah, so I mean, certainly I think, you know, email with questions and stuff like that, and we'll do the best we can to answer them, so, all right?
motion to adjourn.
Yeah, I'd entertain a motion to adjourn. Anyone, second?
Second motion to adjourn?
All those in favor?
Aye.
Aye? Thank you very much.
Thank you.